someone can call him and just explain.
Age. Most of the time, you'll find that when people are advancing in age, it comes in with so many factors, so it will predispose you to hypertension. But we have other risk factors that we call lifestyle. Lifestyle disease, the risk factors, there are things like obesity, sedentary lifestyle here, meaning you're seeing the current people, you'll find the current youth population is affected by mostly they're working. We call them the working population. So most of the time you'll find they're spending most of the time at their workplaces, maybe when they're coming out in the evening, because the job is an 8 to 5 job. So when they're coming back in the evening, they're tired, so they just sleep. So they tend to have very minimal exercise. So this is what now we call sedentary lifestyle, lack of inactivity during your the days of this particular person. So this sedentary lifestyle will predispose you to so many factors that at the end of the day, you might have hypertension. And another thing is salt diet. When you take a lot of salt, that one can also predispose you to having hypertension. Of course, the other factors is maybe if you have an history of diabetes or if you have a history of renal disease, it can also predispose you to hypertension. When it comes to statistics, statistics are currently they're showing that about 1.13 billion of people worldwide they have been diagnosed with hypertension. And then when you look at the country-wise, Kenya has a prevalence of 24%. So the 24% of the population, like currently, have been diagnosed with hypertension. The today's world is not like previously when you used to know like hypertension is a disease of the old. Things have changed, and right now we are seeing diagnosis of youths between 20 to 40 years having diabetes. This can be argued in this point whereby alcoholism has become rampant. There's smoking. Earlier we said is issue to do with physical inactivity, and then of course obesity. Diet, diet there plays along. So these factors, when put together, they can attribute to the high number of new cases that is among the high number cases of youth having hypertension, rather to the previous notion where we said that where it was used to be thought like or assumed that hypertension is a disease of the old. So generally, hypertension comes in most of the time. It is diagnosed as a random diagnosis. We diagnose you with hypertension when maybe, for example, you've gone to a hospital randomly due to another disease, and then on your blood pressure monitoring or blood pressure measurement, it is noted that you're having a high blood pressure. So this has led to many aspects, and then that has linked hypertension to be termed as a silent killer, whereby most of the time it won't show any symptoms at all. And maybe the symptoms that they'll show may be when the blood pressure is very highly elevated, that it can cause headache or severe forms of complications of the high elevated blood pressure. But generally, if the symptom presents, you'll have headache, mild dizziness, and on severe forms, you're at risk of getting a stroke or a blood spilling into your head, what we call a hemorrhage. So it will cause something we call a hemorrhagic stroke. I know as I continue, someone can ask me a question, I'll be obliged to answer. Where someone doesn't understand, I can give an input on that, regarding the question. So the complications of hypertension, we are seeing, number one, we've said is stroke. When you have hypertension that is uncontrolled, you are at risk of getting renal failure. And the other one is you are at risk of even getting a heart failure or heart disease. Majorly for diagnosis, we usually advise that sometimes, depending with the level of the hypertension, because we have hypertension, mild hypertension, where it is a blood pressure of 139 to about 140 to 159 over 90 to 99. And then we have moderate hypertension, whereby we have 159 systolic to about 169 over about 99 to 109. Then we have severe hypertension, where you'll find we have very high elevated blood pressure of above 180 over 100. So depending with where your blood pressure will be, we may start you on management. We'll start you with maybe trying to check on your diet. Yeah, we check on the diet first, like salt reduction. We advise on physical activity, exercising. And then if that one doesn't work, here is when maybe, again, now we can now input pharmacological management, where we initiate you on drugs and then titrate the dosages up to where we'll feel that, or where we'll view that your blood pressure has gone back to normal. Anyone with a question so far? Any question? Hello?
We can get you.
No one with a question?
Well, not for now, but we're following you. We're following the instruction.
Okay, so generally that is hypertension and how it is affecting the general population. So with the youth, we've said that why we are having this hypertension among this age group is that it's because of the sedentary lifestyle or the inactivity. This inactivity tends to cause this inactivity can lead to, one, obesity. It can also lead to elevated cholesterol level. Here, these elevated cholesterol levels can cause clogging of the arteries. This clogging of the arteries can cause what we call cardiac diseases or heart diseases. These heart diseases, when they come in and they develop, they can also lead to hypertension. So the presence of having heart disease can also predispose you to having hypertension. Earlier, we also said that having diabetes and having like a renal disease, they can also predispose you to having hypertension. On the other hand, you'll find that hypertension itself can also lead to you having a heart disease or a renal disease on severe. When it is not managed well, it can lead to such complications. Are we together up to there?
Oh yeah, sure. Very well. Very well.
Yes, yes, yes.
Yes, you are together up to there.
Okay. I don't know if Mutuku has an input, has any.
Excuse me.
Mutuku?
Excuse me, sir.
Vincent, kindly mute yourself.
Sorry?
Kindly mute yourself.
I have a question to Mr.
Yes.
Wanalo.
Okay.
So, okay, it's more of a request.
Yes.
You've talked about primary hypertension and the risk factors.
Yes.
What about secondary hypertension and its risk factors? Could you please talk about it?
Okay. So secondary hypertension, you'll find that I've talked about it. It's just that I didn't specify. It's usually brought about by another disease. It comes as a result of something else. So, like for example, in this case, we've talked about having diabetes, right?
Yes.
So you'll find diabetes can lead to renal failure in itself. Like one of the complications of diabetes is renal failure. So this renal failure will predispose you to hypertension, because when you look at how the hypertension usually comes in, there's usually what we call a system called RAS. And this RAS system you usually find in the kidneys. So what happens is diabetes messes with these kidneys, and when it messes with these kidneys, it also affects the RAS system. So you'll find that diabetes leads to renal failure leads to hypertension. So renal failure in itself also does lead to hypertension directly. The other thing I talked about is heart disease. So having a heart disease, because it's the pump, and we've said that blood pressure is the force that exerts, that the blood exerts on the artery walls. So you'll find that a heart disease will impair the output of that blood. So that blood will lead to, that heart disease will lead to hypertension. The other thing I talked about is, of course, having arteries, what I called atherosclerosis. That one also leads directly to hypertension. We clear?
Yes, it is. Thank you.
Yes, welcome. Anyone else with a question?
Hello, good evening.
Good evening.
Yes.
That's good.
Yeah.
Yeah, I had a question. So
Yes.
does
I was just going to ask,
hypertension affect the genetic makeup?
extend the presentation to now we've gotten so much about causes.
Yes.
Can we look at symptoms and cure? Are we still getting into that?
Okay, I'll look at that. The Bafemi.
Yes. Thank you.
Yes. Tuko, you had something?
Yeah, good evening.
Yes,
Good evening.
thank you. Good evening.
That, does hypertension affect the genetic makeup?
Now,
And because you said genetics is one of the causes that like it can be transmitted from a parent to a child. So,
yes.
so if at all this hypertension can affect the genetic makeup of an individual, then what are the measures we can take to prevent the passing of traits from the father to the child?
Okay, now we use on that genetics and hypertension. There's a systems in the genetics, yeah. So you'll find out that there are some genes that can be able to transmit some certain diseases from one generation to another. So you'll find like in the hypertension, we have the HLA system in the genetic makeup. So this HLA system sometimes can be, like I can say it can be transcribed like in these, from this generation to the other. So let me say like, for example, if my dad had hypertension, there's a highly likelihood that my kids will also have hypertension due to the genetic makeup that has been interfered by the HLA system. Is that okay?
Yes, it's okay. Then how can we control it? Or is there's no other way of controlling that passing of traits?
With genetics, we usually call it like it's familial, so that one you cannot control it. So that's why we are saying it's a primary cause of hypertension.
Okay, thank you very much. I understand.
Yes. Tuku had something again.
Yes, good evening. So my question was, is stress a major risk factor to hypertension? And if so, how can we really control it?
Mm-hmm. So what happens on stress? Stress interferes with a lot of system in the body, whereby if you are in a highly stressful event, you will find that your mind will be stressed, and because your brain is stressed, it is involved in the hormonal processes, right? So these hormonal processes might lead to elevated blood pressure. How? Because when you are in a very highly stressful event, you'll find that in this category, you can get what we call palpitations, your heart beating fast, very fast. So this one can lead to an elevation of blood pressure. Stressful events can be controlled. How? We have what we call counseling sessions. And then if you're prone to having frequent stressful episodes, you need to understand like how, what usually makes you to get this, to get these stressful events. If it's, let me say, for example, among many people, one of the most stressing events is usually about money or relationships or work. So you need to know, like you need to moderate your life, or you need to moderate the causes of the recurrent stressful events that you may experience. If it is relationship, you need to talk about it. If it doesn't work, you can talk to a counselor or a third party, whereby a consensus situation can be achieved between you two. If it is about finances, you can start by planning your finances bit by bit. If it is about work, there's this saying that goes, don't love your work too much. Yeah, moderate. Don't let your work interferes with your let me say your free life. So let me say like something like that, because you need to moderate between work and yourself being you when you go home, or you when you have your back with your family. Because if you concentrate on work too much, it will lead to stressful events. That's okay? Okay. And then again, Obafemi had an issue with symptoms. We've said most of the time hypertension is a silent killer, whereby primarily you may not experience any symptoms at all until maybe when the blood pressure is highly elevated. And when I say highly elevated, you remember we said we have severe forms of hypertension, and then we had moderate hypertension. So most of the time, mild hypertension, you may not experience any symptoms at all. But when you come to moderate, because the blood pressure will be elevated from about 160 to 179, you might experience headaches, frequent headaches, especially morning headaches, yeah, early morning headaches, or dizziness. And then severe forms of hypertension. In this case, most of the time it presents with complications. And I said one complication is stroke. So stroke, in this case, you'll have your blood spilling to your head, in your brain, what we call a hemorrhagic stroke. Obafemi, are we clear up to there?
Yeah, please. So clear, yes.
Yeah, so symptoms generally is just early morning headaches, and then that is for moderate hypertension, right? But for mild hypertension, you may not experience any symptoms, what we call asymptomatic presentation.
Okay.
Yes.
Are there controls? Are there precautions? Are there
yes.
medical? Okay.
Of the precautions, we said like because one of the causes we're looking at, one of the causes is sedentary lifestyle, right? The physical inactivity. So we need to relieve that. Like you need to start having exercise, frequent exercise. And when you look at WHO's recommendation, it says about 15 to 20 minutes daily or 5 times walk.
Okay.
Brisk jog. So 15 to 20 minutes of jogging or a brisk walk 5 times in a day will be able to reduce the physical inactivity of an individual.
Yeah.
Okay.
Yeah.
Then
yes.
Number two, we've seen salt intake is one of the causes of hypertension, right? So reduce your salt intake up to 5 grams. 1 teaspoon of salt, yeah, the normal table salt, yeah.
Right.
It's about 5 grams. So we need to reduce our salt intake to 5 grams of salt in a day. Yes, because when we take too much salt, it leads to what we call sodium retention. Salt is simply sodium chloride.
Yeah.
So excessive use of salt will lead to sodium retention. This sodium retention, when it's in excess, it will lead to hypertension. Okay?
Yeah. Thank you very much.
Yes, when it comes to as a cause, we need to physical exercise again, so that we can try lose the weight.
Okay. That's quite clear. Thank you very much.
Yes. Okay. Welcome.
So, excuse me, sir. I have one more question.
Yes. This is Vincent.
Yes.
Yes, Vincent.
Okay. So, hypertension is okay. There is a myth about hypertension. It being a short-term disease, quote unquote, the people say in the village imepona. How true is that? Because from my little understanding, it is almost a lifelong disease. So I don't know. Maybe just say something about it.
Hypertension is a chronic disease. Yeah? We say it's a lifelong disease because once it has set in, because you remember the first time I said, like on management treatment, we try to manage this hypertension with you doing diet restrictions, you trying to do physical activity so that we can try to control that hypertension. So when it won't respond to the diet and physical exercise, we now initiate you on drugs. So these drugs, we will moderate them depending on how the blood pressure is behaving, until to a point whereby you will be on the minimal or the most minimum dosages. But hypertension is a lifelong disease. Once it has set in, it has set in. Okay?
Okay, and on that note, once the conservative management has failed and the patient is recommended to do pharmacological management. So at pharmacological management, the patient is supposed to take the drugs as well as exercise and have low intake of salts. Is that the recommendation or something?
Yes, actually that's the recommendation, because these drugs we're trying to normalize the blood pressure with them, because there are some instances whereby we'll put you on one drug, we call it monotherapy. When the monotherapy fails, we'll put you on a dual therapy. We'll give you 2 drugs. When that one fails, we'll add you another drug to make it triple. So you see, if you start practicing the diet restriction, salt restriction, exercising, so that you can minimize the factors that are causing this hypertension to be severe, you find that plus the drugs, the optimization will become better. So if we put you on drugs and still you did not take care or try to prevent those other factors, you find that we'll be doing like we are doing a zero work. We're giving you medication to normalize, but then again, you are there with the salt, still salt intake still high. You're still, your diet is still unhealthy, like high calorie foods and all that. You're still not exercising. So we'll be like, we are correcting, you are uncorrecting. So this will lead to this blood pressure becoming uncontrolled and fluctuating. When it fluctuates like that, you see, it will predispose you to a high likelihood of you developing complications. And then we said complication like one, it's renal failure. So when you're having a renal failure in the anemia of hypertension, already it will become problematic to controlling that particular hypertension.
Okay, and okay, I've gotten that. So is there a stage whereby if you had a cooperative patient who is taking the dosage as required and doing the exercise and cutting on the unhealthy diet, is there a point where you can reach and now you can tell this patient, I can now take you off the drugs, but you continue living healthy lifestyle, the exercise and the diet? Can a patient reach that point? Or is it that a patient will have to take drugs for the rest of his or her life?
Now it depends. Depends with the stage where we diagnosed your hypertension on, or the underlying factors. Because you'll find that if this patient was diagnosed when maybe it was a mild case and it was a secondary hypertension, meaning it was caused by something else, and then we have taken care of that something else that caused this hypertension, and then this patient has been very adherent. He's managed to follow the advice of non-pharmacological management, and the drugs are also doing quite well. So we'll start also reducing the drug dosages up to a point where we'll feel like, okay, we can now get this patient off this medication. And then now we again will go back to the first instance. We try, see the non-pharmacological management, if it will work. If it will work, you will just be on follow-up. If it won't, we will return you back to the minimal dosage of the drugs.
Okay, so the condition is something that, let's say, it does not resolve, because, for example, let's just use, for example, a flu. You can get a flu, and then after some time you do maybe some hot drinks, some few drugs, and it resolves.
Yes.
So that is not the same thing for hypertension. So it's something that will stay for life or something like that.
It's a chronic disease. That's why we call it a chronic disease. It will be there for some time.
Okay. So okay, I get your point now. Thank you very much.
Welcome.
Good
Douglas?
evening. Yes.
Yes.
Hello. So my concern is on the issue of drug and substance abuse. How is it related to? Excuse.
Yes.
Can you hear me?
I can hear you. Drugs and substance abuse, how is it related to?
To hypertension and what would be the effects on such a patient who is addicted to drugs and substance abuse?
Drugs and substance abuse, like for example, in this case, we'll talk about smoking and maybe let's say cocaine, right? So you'll find these drugs, they have an effect on heart rate. Yeah, even alcohol, on the first instance, it has an effect on heart rate. So what they do, they'll cause the heart to beat very rapidly. And again, I said, when the heart rate is very high, it will have an influence on the blood pressure force that is exerted on the arterial walls. So this will lead to hypertension, especially if this substance abuse is so very severe forms, like you're highly abusing these drugs. For alcohol, it is usually multi-organ because one of the first things it will do, it will cause liver cirrhosis. When you have liver cirrhosis, you might have what we call a portal hypertension, whereby the hypertension in the liver, there's some veins, there's some blood vessels called the portal system. So what alcohol does, it causes the liver cirrhosis. So the liver cirrhosis will lead to portal hypertension. This portal hypertension can have an effect on the heart and cause maybe heart disease, which will also lead to hypertension. And then alcohol can lead to renal failure. Too much consumption of alcohol will destroy your kidneys, leading to you becoming diagnosed with kidney failure. So this kidney failure, we've talked about that is the major cause of hypertension. That is okay?
Yes, thank you.
Yes. So as Obafemi also asked about the preventive measures, we also reduce alcohol intake and we quit smoking.
Okay.
Because these are the factors that predispose you to having this disease.
I see. Thank you.
I have a question.
Yes, Tuku.
Yeah, so I was diagnosed with hypertension some few weeks ago, and so I experienced severe headaches, and so I decided to go to hospital. And my physician administered some drugs to me, which were the dosage would take 1 month, according to But when I went to the chemist, the madam at the chemist, we had a conversation with her, and she was reluctant in even giving me the medicines, and she sent me for other tests, and I was advised to take water. So, but finally she sold me the drugs. But when I went home, I decided not to take the drugs because I was told I may be jailed to take in the medicines forever. Like I may have to take the medicines forever. But so I decided then to maybe try water, and I've been taking a lot of water, and in the morning, in the evening, every time, really a lot of water. And I would say it has helped because my blood pressure now has is coming to normal.
When was
So
the last read? When was
the last test was today. The last test, yeah, and my tests were, it was 128, 84. So that was today, and I've reduced my sodium intake. I'm not taking a lot of salt, and I'm also taking a lot of water. So maybe I don't know whether that would be recommended as a therapy for someone to try to take a lot of water as a therapy for hypertension. Yeah.
Okay. One thing I'll say on that note is that the chemist, someone at the chemist is not allowed to send you for lab test, right? Like is not allowed to send you for a lab test. And then again, because the doctor who saw you, yeah, there are some factors he factored into deciding to prescribe the medication that he prescribes. Yeah. Another factor that I'll say is that water in itself, yeah, can lead to hypertension, can cause your blood pressure to be elevated. This is because when you take too much water that is not that is not measured, like the quantity is not measured, what it will do is that it can lead to fluid retention, like accumulation of fluids in the body, whereby you've taken in a lot of water, so the input is not equated to whatever you're producing out. So you see, if that balance is not achieved, what will happen? Your kidneys will retain the water. When it retains the water, it will lead to hypertension, because you see, the salt intake, we're trying to tell you to reduce the salt intake so that we can reduce the water retention. Okay? So if your body is retaining a lot of water, what happens is it will now cause your blood pressure to be still elevated. Okay? So your blood pressure, the last reading is not very bad. It's still within the normal range. Eh? So what I'll advise in this case is you keep up appointments. Okay? Keep up appointments, even if it is weekly or every 2 days, so that your blood pressure is monitored closely. So when it reaches a point whereby the doctor will see like the blood pressure is still persistently high, depending on the level that it will be, he'll now initiate you with the medication. As I said, medication, okay, the notion of being jailed on the drugs for long term is now, I'll ask you this view. Would you rather, which one will you mind? Taking a single pill every day for the rest of your life, or not taking the pill, and then one of these early mornings you rush to the hospital, and then we say like you're having a hemorrhage. Which one will you prefer?
Yeah, taking pills.
Yeah, it's a precautionary measure. Like if the doctor sees that your blood pressure is persistently elevated, and he's talked to you about and advised on salt reduction, exercising, and diet change, but he sees that these measures are not working, he will initiate drugs to try and regulate this blood pressure so that he can prevent the complication from happening. Okay?
Yeah.
Yes, and especially with the blood pressure, I'll advise we go to the hospital, not the chemist. Okay?
Yeah. And
yes, because at the chemist, but at the hospital, you have the doctor.
Yeah. And maybe before I quit, what would be a cause for the blood pressure imbalance? Because at some point I go for the recordings and I'm told my pressure is too low. Like yesterday, my pressure went to 91/52. But going some other time, it is high. It is now maybe 133.92. Like, so what would be a cause for these imbalances?
Now, one of the factors that that leads to low blood pressure is dehydration. Okay, dehydration is one of the factors. When you are having when you are dehydrated, you will have low blood pressure, or when you've lost quite a number of blood, maybe you're bleeding from somewhere, your blood pressure would be low. There are some other diseases that can also cause the low blood pressure, but for the fluctuations, why the high and the low is maybe the point of measurement. Maybe at that particular point where it was measured to be 130.92, maybe you had just reached at the hospital, you've not settled, because ideally you're supposed to at least relax for 5 to 10 minutes before your blood pressure is taken. Yeah. So when it's high like that, 130/92, I will advise, like, you request, like, you can be told to wait a bit. Let me say like 10, 15 minutes, and then they repeat the blood pressure again. See if it will still be that high, or it will have normalized. Okay.
Yeah.
Yes. So those are the factors that lead to that.
Thank you.
Excuse me, sir.
Yes, Vincent.
Okay, I have a question about diagnosing of hypertension.
Yes.
So is it a condition that is diagnosed within a day, or is it a condition that is diagnosed after a series of measures? Because there are so many factors that can lead to elevated blood pressure. Probably underlying condition which could have relapsed within a few days. Probably the person could have had increased physical activity or something. So, okay, I'm lost on that. Please just clarify.
Three readings that will still suggest that your blood pressure is persistently high. But at the same time, it depends with the level or the level of the measurement. Is the measurement almost like suggest mild hypertension, or does it suggest severe hypertension? Because if you're coming in with blood pressure of more than 200/110, at that particular point, it may force the doctor to try and reduce that blood pressure to near normal. That is after repeating the blood pressure at that instance, maybe twice or thrice on intervals, let me say 5 to 10 minutes. So if it will still be persistently high, the doctor might be forced to reduce that blood pressure on that instant. But if, let me say, for example, you're coming in with a mild forms of blood pressure, like in the case of Tukus, where he went in with 131/92, that particular case, we'll advise on the non-pharmacological management, and then give you a return date, maybe the next day, so that we can also repeat the blood pressure and see how they are. So at least 2 or 3 instances will give you a diagnosis of hypertension. Okay.
I think, yeah, I get your point now. That is better.
Any other question?
Good evening.
Good evening.
I have a question on atherosclerosis, how it leads to hypertension. Can you explain more about it? And can hypertension lead to atherosclerosis? Can it go the different way? Yeah, that's my question.
Now, what happens with atherosclerosis? Atherosclerosis is simply clogging of the arteries, right? So when you're having high cholesterol levels, this cholesterol can be deposited on the arteries. When it gets deposited on the arteries, when the blood pressure is being pumped, it can lead to this like the clogged cholesterols or fats deposition to be plaqued. And when they are plaqued, they can go all the way up to the heart. So this one will lead to a heart disease, what we call the coronary, acute coronary syndrome. This acute coronary syndrome can lead to hypertension because now it will affect the heart, making the heart having a failure in its pumping action, which now will lead to hypertension. What causes atherosclerosis is simply high cholesterol levels in your body. Diet, again, it's a lifestyle disease. When you take foods high in fat diet, it can lead to that atherosclerosis.
But hypertension can't lead to
that. Because you see, we've said it's a deposition. It's a deposition of the fats. So if the fats are not there in the first place, even if you have hypertension, now there will be no deposition of those fats or the cholesterol in that. You get?
Yes. Thank you.
Yes. So that one can lead to, and then it cannot. The other one cannot lead to the other.
Okay.
There is something. Okay, just to clarify, just ask.
Yes, Vincent.
You've said that hypertension. Okay, atherosclerosis can lead to hypertension, but hypertension cannot lead to atherosclerosis. Or I didn't get that one.
Yes.
Oh, okay. Now I get it.
What I was saying is because we've said that the atherosclerosis is the deposition of the fat, right?
Yes.
So take it in this case scenario, we are having a piped water, right?
Yeah.
This piped water has grease already. This water has grease. So this grease might end up being deposited on the pipe walls, right?
Yes.
Which at the end of the day, it will cause clogging. And then there's scenario 2 where we are having a pipe, clean water, no grease. Will there be any grease to clog those pipes?
No.
No, there won't. So it's just the same case as the atherosclerosis and hypertension. What hypertension can do on the artery is maybe creating what we call an embolus or a thrombi, whereby it can dislodge and thrombi from somewhere or a clot from somewhere else and come and clog the arteries somewhere else, but it can't cause the hypertension per se or directly in that case.
There is no hormonal relationship between atherosclerosis and hypertension.
That's why I was saying the atherosclerosis will lead to acute coronary syndrome. The acute coronary syndrome may lead to hypertension.
Okay.
It's a series of events.
Yes, I get your point.
Yes.
Thank you.
Yes. Another question? Maybe last one? Okay, none. Mutuku, any question?
Mutuku, there is someone who would ask about the foods to take. Foods to take during hypertension, food supplements. There's someone who would ask.
Generally on diet, what you will avoid is high calorie foods like the donuts, too much sausages, too much pizza or something, all that types of high calorie foods. This is because they lead to you having high cholesterol levels, and then again they predispose you to having diabetes. Diabetes will also lead to the hypertension being highly uncontrolled. But majorly, you need to take increased vegetables and fruit diet, reduce on salt, and reduce on the high calorie foods. Okay?
Yes.
Yes, so that is just generally on diet, and then plus when you add that plus physical exercise, and we'll keep the hypertension at bay. Okay?
Yeah.
Any other input or question? Good. I think at that juncture, maybe questions is if someone has a question, maybe later, even during the question, or maybe tomorrow, or any other day, can always reach me. I'll be able to answer any of your queries.
Hello.
Can we have your contact? Can we have your contact?
You can find me on Facebook as Wanalo James.
Okay.
Yes,
right.
And there's a specialist, diabetes hypertension specialist page that we run on Facebook. It's called the Diabetic Hypertension Clinic. Yes, you can follow the page, and if you have any queries, you can always leave a message.
Fantastic. Thank you very much.
Yes.
Thank you for the good presentation, so detailed. Thank you so very much.
Thank you too.
Anyone else who has a question or an insight?
All right. Like, are we allowed to speak? Can you hear me?
Yeah.
I can hear you, Steve.
All right. I'm Kevin, Stephen. I appreciate the fact that you had time and you gave us this lecture. So I just wanted to say thank you, and may you be blessed for just having time for us. Thank you, sir.
Thank you too, Stephen. I appreciate that.
Hello.
Yes, Togo.
Hello.
So maybe I have a request. You could share your contact details and maybe where your clinic is located. Thank you.
Okay, as I said, you can be able to find me on Facebook as Wanalo James, or you can follow up a page that we run with other specialists, Diabetic and Hypertension Clinic Facebook page. If you have a query, you can leave a message, and we'll always be at your disposal to try and assist where we can.
Thank you.
All right. I think at that juncture, if there's no any other question or query or concern, we can wind up and We can always meet at another time.
Thank you so much, Mr. James Wanalo. It was such an insightful session about hypertension. And we are really glad by taking your time to teach us and to make us know what is hypertension. And we are so glad as our team for joining us. So if there is nothing else, I guess we can end the meeting unless anyone has a question. And I think for the contacts, if anyone has a problem, they can always share with me, and then I can share your contact with them. That will be easier. Thank you all for joining the meeting. Have a good night.
Thank you too. Thank you too, guys, for having this meeting.
Thank you, everyone.
Very much.
Thank you.
So grateful for the presentation. And thank you, Dr. Jim.